Interviewing. Case history 2 and 3 on migraine. A 50-year-old woman had been suffering from headaches since she was 18 years old. The headaches occurred mostly on the right temple area, were of a throbbing character and were accompanied by blurred vision. The headaches were better during pregnancy and worse from taking hormone replacement therapy. She also suffered from insomnia and constipation. Her periods had recently become irregular, and the menstrual blood had dark clots. Her cheeks were red, and her eyes lacked sparkle and looked nervous. Her tongue was red and slightly purple, redder on the sides, and did not have enough coating. Her pulse was fine and slightly rapid. Diagnosis. The headaches are clearly due to the rising of liver yang, indicated by their throbbing character, the location on the temple, the blurred vision, the red cheeks, and the insomnia. In this case, liver yang rises from a deficiency of liver yin, which is manifested by the lack of coating on the tongue, the constipation, and the blurred vision. The amelioration during the pregnancies and aggravation from taking HRT, in this case, indicate a liver disharmony. The slightly purple color of the tongue indicates a tendency to blood stasis, of which the dark menstrual clots were the only symptoms. Next, case history 3. A 36-year-old man complained of migraines since the age of 11. The attacks came every few months, affecting either side of the head along the gallbladder channel. The pain was sharp and throbbing and was often accompanied by vomiting and blurred vision. In between the severe attacks, he occasionally suffered from a dull occipital headache. He also suffered from high blood pressure, for which he took medication, which, however, did not control it well. He also complained of a dry mouth, and the interrogation did not reveal any kidney symptoms. He was overweight, and his complexion was dull pale with a greasy skin and several small pale moles on the face. His eyes were very dull and lacking of luster. His tongue was dark red with a redder tip, swollen and with a rootless white coating that looked like salt. Although he was on the beta blockers, which alter the pulse significantly, making it deep and slow, his pulse was very weak on both rear positions. Diagnosis on this case: the headaches are clearly due to liver yang rising, which is evidenced by the severity and throbbing nature of the pain, vomiting, and blurred vision. In this case, the origin of liver yang rising is in liver and kidney yin deficiency. This is apparent from the tongue, which shows a severe yin deficiency with empty heat. It is unusual but not infrequent that there are no other symptoms of kidney deficiency, and the dry mouth is the only symptom of yin deficiency. Exactly the same pathology that is causing the headaches is also at the root of the hypertension. His complexion and body shape contradict the above patterns because the complexion is dull pale, while it should be red or floating red, and the body shape is overweight, while yin deficiency usually causes a person to be thin. This is due to the presence of phlegm, of which he has no other symptoms. However, certain signs show the presence of phlegm. These are the swelling of the tongue, the dull pale complexion, the greasy skin with small pale moles, and the overweight body shape. The lack of shen of the eyes indicates severe emotional problems, which he confirmed having, which may also be causing the complexion to be dull and pale, contradicting the tongue. Thank you for your attention.